Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about the offerings of Cape Cod Healthcare, our local healthcare provider. Today's program we have as our guest, we're lucky enough to have the President and CEO, Mike Lauf, with us. Thank you so much for making the time to be here. I appreciate it.
Hi, Jeanne. Thank you very much for having me.
So for many of the viewers, you probably recognize Mike because I know he does get out and about and has done presentations at the senior centers, and you'll find him on their website. But just a brief overview of how did you come to be here on Cape Cod, and how did you get into healthcare in general?
Well, you know, we were very fortunate enough, my wife Jill and I, to come here 4.5 years ago, and the Cape has been a very special place for us because it's allowed us to, one, we came with Harrison, our oldest, but also had Anderson while we've been here. So we have two boys, almost 6 and 3. We got to Cape Cod because of the incredible opportunity. Cape Cod Healthcare, we knew represented the type of environment that we wanted to be in, both professionally and from a community family perspective. Not-for-profit, community governed, locally run, a great chance to not only influence the healthcare that was provided on the Cape, but also to be a part of the community. So that really met all of the criteria that we wanted to look for when choosing a community and or a job. Very fortunate to get into healthcare approximately 20 years ago. As I began my career working for a member of Congress, John P. Murtha, we did a lot in the appropriations process, a lot through the Department of Defense, and really familiarized myself through that opportunity to understand research and the positive impact that healthcare had in local communities and nationally. So from that experience, I parlayed it to get into healthcare, and it's been an incredible journey ever since.
It has been. That's wonderful. Yeah. Now, Cape Cod Healthcare is positioned for upcoming changes in the healthcare environment. What does the system need to do to ensure sort of being successful?
Well, I think the most concerning part about the future is kind of the unknown. We're not quite sure what the federal impact will be in the Affordable Care Act and what the new state legislation, Act 224, will mean. So in light of that, you know, we have to focus on key approaches to ensure that we are here for the community for the long term. So we've really broken it down into specific buckets focused around quality. I mean, patient care is what we do. It's what we believe strongly in. So everything we do starts with quality, with a positive patient outcome in mind. From that perspective, we also look at service. How do we work with our community and our patients to ensure that we're meeting their needs? You have to dedicate yourself to the refinement of process and simply taking variation out of process to ensure that you're meeting the quality objective that you mentioned earlier, that I mentioned earlier. Physician alignment is so big and so important. If I can think about one of the most important things that we've done over the last 4.5 years, it's really been partnering with our physicians, ensuring that we're aligned and we're approaching complex issues together rather than apart. And I think that's really helped in our transformation. And I think, you know, lastly, a dedication to operational and financial excellence, because if you're not doing all those things, if you're not controlling what you can control, then you won't have a positive impact at the end of the day. So simplistically, that's our approach, and I'm proud to say that I work with 4,700 plus people in pursuit of that approach.
Right. Now, I know when you said the physician, it was just a reminder to myself, for the viewers, is the sort of misconception that physicians actually are employed by or work for the hospital, and they don't. I mean, there are a few, but could you just address that? The difference between? Well,
we have over 450 active medical staff members in our community. And to put that in perspective, Cape Cod Healthcare employs about 150 of them.
Okay.
So most of the medical staff is volunteer in nature, meaning they're independent physicians, all dedicated to their patients and the community that they serve. And it's my job, it's our job as part of Cape Cod Healthcare to meet their needs, as well as those of the employed physicians. Because when we're satisfying their needs, when we're satisfying our patients' needs, the relationship becomes collaborative and positive, and that's what we've really worked hard to do.
So the customers so to speak, of the system aren't just the patients, it's also the physicians.
Absolutely.
Yeah.
We have to ensure that the patient has the best outcome possible, but we also have to make sure that we're listening to the voice of the consumer, the patient, as well as one of the leading consumers, the physician. So there's a delicate balance, and we always try to err on the side of the physician and, of course, the patient.
Because in the end, the patient will benefit.
You have to be integrated at the end of the day.
Yeah. Now, what about access? Is there systematic plans to improve access for patients on Cape Cod, or?
We do, and it goes back to the physician partnership first and foremost.
Okay.
Do we have the right number of physicians on the Cape? Are there panels open, or are there offices open and accepting new patients? One of the biggest things we've heard of since we've gotten to the Cape and really started down this path, this journey, has really been patient access to get into physician offices.
Mm-hmm.
So we've been going out to partner with physicians or recruit new physicians to meet the needs of the patient. We've made some improvements. Have we made them across the board? No. It also starts with appointment availability, and this is what I'm very proud of. We've been able to reduce the time that it takes to get in get an MRI, to get a CAT scan, to get a mammogram. We've improved our processes from A to Z from that perspective. We need to do a little bit more from the patient perspective in terms of the primary care setting. In terms of the test setting, whether it be our incredible C-Lab locations, to the VNA, to all the entities in Cape Cod Healthcare, we've improved access. We've also worked to aggregate services. So rather than be so hospital-centric, we're really approaching, and the VNA is a great example of this, how do you become more patient-centric? How do we take care closer to the patients so they don't need to be inconvenienced or travel large distances? So we've aggregated outpatient services in 6 or 7 centers across the Cape, in Harwich and Chatham.
So Harwich is Fontaine.
Harwich is
people
Fontaine.
Might be familiar, yeah.
Chatham will be opening up, the new Chatham location will be opening up in March.
Okay.
The new Wilkins Pavilion and the CUDA Women's Imaging Center, a terrific approach that we also relocated or located dermatology to as well. Sandwich is going over a major overhaul with the help of incredible donors Jim and Thea Stoneman. The Falmouth Medical Office Building, the Clark Cancer Center, Jim and Ruth Clark with an incredible lead gift to us. We've been able to take care closer to the patient by relocating radiation therapy services in Falmouth as well as the Cape, and doing it as a system approach, so the care you get there is identical in both locations.
Right.
To also Mashpee and Bourne, we have great service offerings in all these locations, from primary care to imaging to lab to physical therapy, and we think by using this approach, partnering with our doctors, getting services closer to where our patients are, will ultimately improve the care that they receive.
Mm-hmm. Now, the Wilkins CUDA, you had mentioned that that's actually in Hyannis.
Correct.
Does that take away some of the congestion that's at the hospital, or is it all just a whole different set of services that are offered there?
Well, it does. It takes over 150 cars a day out of the Hyannis campus. But more importantly, we took an incredible center, or we took a service that is so important to so many. We moved it to an incredible location, but what I'm most proud of is we improved the processes along the way. So the patients are getting a better experience, not only in the physical sense, but in the emotional and social sense as well. So we're very proud of that. But 150 cars have now gone over there for mammography and C-Lab and radiology service. We have a 3-tier, it's an intense magnet over there to also help with breast imaging and other issues. So we're very proud of that center.
I bet for any of the viewers that are out there that have gone for services, maybe traditionally at the hospital, that have made that switch, I'm sure they feel the difference of
it certainly is
jumping off the
place.
highway and hitting that before going into downtown. Yeah,
absolutely.
Yeah, that's great. Now, let's talk a little bit about some of the physician relationships or partnerships. I know you mentioned it at the Open, how important those relationships are, and there's been a lot done with some of the PHO, PPO type organizations that you've put together.
Well,
just to help people understand how that all works a little bit.
A little over 2 years ago, in concert with our board, our medical staff, a bunch of committed people, we knew that, again, to achieve future success, to align, to meet the needs of the changing healthcare landscape and environment, we had to do something different. So we sat down and created a PHO, or a physician hospital organization.
Okay.
And essentially, at the end of the day, that means that over 300 physicians out of the 450 on active medical staff over 300 physicians have agreed to partner with us to clinically integrate. And what does that mean? Well, we work in concert together to improve outcomes for patients. And in doing so, you can go and enter into new payment methodologies to try to be a part of the solution to lower overall costs in healthcare while improving quality. It's kind of the prelude to the accountable care organization that I'm sure so many of your viewers have heard about. And it's really a proactive way to meet the needs of the healthcare community, partner with your physicians, and be a part of the solution to improve quality while lowering cost.
So it's a team effort.
Absolutely.
For the end result.
And what's also key there is not only that organization, but to manage populations well. And I think this is lost in a lot of the dialogue that's happening both at the state level and national level. To do it well, yes, you need to be integrated with your physicians, but you also need to have a common information systems platform, a way in which two disparate or two different organizations can talk to one another, can share information to improve the care of the patient. And in this regard, we've invested a lot of money into a new Allscripts electronic medical record in the ambulatory setting, while we're also have recently gone through a major information conversion in the hospital setting with the Siemens Sorium project. So we think by leveraging those two new information systems, we'll be able to better communicate with our physicians, better communicate with our patients, ensure that tests aren't being duplicated, information is waiting for the patient, and we think we'll be able to manage populations better in that PHO.
So for the viewers that are patients that may say, so what's in that for me? So does that mean no longer do I have to repeat my name, address, and history? It will be in the computer somewhere and it will travel with me from place to place?
Well, there's a lot of checks and balances in healthcare today,
Yeah.
and I don't think we're going to see any of the paperwork or charting in this case go down. What I think it will mean is that rather than not necessarily stop you from having to register a bunch of places,
Right.
what we do think is it's going to stop you from having the same tests done all the different
Excellent.
places along that journey. Ensure that when you stay local and visit between specialists or visit your primary care physician, that your information is there waiting for you. Making sure that the tests that should be done on a proactive basis are being done and documented appropriately so it can even influence your insurance premiums. These are the kind of things that I think this information system will help. And I think it also gives us entree into evidence-based approaches, best outcomes, the prevention of negative pharmacy interactions. So
Right.
I think these are all the positives of information technology. And I think that's where the federal legislation actually got it right.
When they make some of those improvements, and in the end it will improve the health and well-being of the patients.
Absolutely.
Right. So going into healthcare reform a little bit, do you have a sense of how things will change and how I know you had mentioned ACO, and I just am curious, what is a simple description maybe for the viewers of an ACO and how would that work for Cape Cod Healthcare?
Well, an accountable care organization is a group of individuals or entities that all agree to work together to manage the patient. So it starts with the primary care physician, but it can include therapy, can include skilled nursing facilities, it can include everything hospice, VNA, all these entities working in concert with one another to do all the things I just mentioned. One, ensure the patient is getting the best care possible, that the preventative testing is occurring, that evidence-based approaches are there, that information is being shared across different settings. And what I think is also interesting is it kind of likens the business models. So rather than having 3 or 4 different business models, you're all aligned. You all have a piece of that budget or a capitated or global payment that you're out there trying to again, lower cost while improving care. So simplistically, I think it's the coordination of care among many different entities.
So everyone's communicating much better in an ACO environment.
That's what the role is, and I think the goal is, and that's what we're starting to see happen.
Okay. Then anything else that you can address with what might be happening on the federal level or what we might see in the future through some of the healthcare changes?
The federal level is very, very concerning because one thing the Affordable Care Act did do is it really has cut reimbursement, particularly in Medicare and Medicaid. So for us, we about 65% of all of our revenue comes from governmental sources, meaning Medicare and Medicaid. The population on the Cape, 25% of us are over the age of 65. We also know there's a large gap between the average wage earner or the pockets of wealth. So that's concerning. And what the Affordable Care Act did is cut reimbursement. So for the Cape, that means about $100 million over the next 8 years in federal Medicare cuts alone. That's concerning. Are we trying to do all the things that I just mentioned to stay ahead of it? Absolutely. But that unknown that I mentioned at the beginning of the program is something that concerns us all. I think the federal legislation, though, to be fair, has gotten the information technology approach right, trying to do new forms or models of care like accountable care organizations or the Medicare Shared Savings Program. Trying to align different models. So I think that's right. Cutting reimbursement alone and improving access isn't reform. So we'll have to see, and I think those in Washington will work hard to get it right and come up with really a better piece of legislation long term to meet all those needs.
So does your, just a little sidebar, does your early experience in politics help in the work that you're doing today? Because you understand it a little bit better, you were closer to it at one time?
I think it prepared me for any situation. I think it also, I understand very well the difficult job that these politicians have. We're very fortunate on the Cape to be represented by incredible people at the legislative level, the House level, the Senate level. Senator Wolf, Senator Murray, and all our legislative delegation, they work very hard. Representative Bill Keating, recently reelected, has really made a positive impact to us. So I think, Senator Kerry, I think understanding the difficult jobs that they have, the difficulty in pleasing everyone, also while understanding that we have a pretty significant budget crisis in Washington, and at the state, that we have to balance the needs and wants and desires. But one thing that I'd like to see come, and what I hope we get back to a little bit, is really a spirit of compromise. And I'm confident our local leaders will help us get there.
Yay. Good answer.
Really would like to see
I would like to see that. Let's talk a little bit about the VNA's role as part of Cape Cod Healthcare. There are a lot of different members of Cape Cod Healthcare, but we'll talk about the VNA right now.
Well, I think the VNA is perhaps positioned the best because one of the things that we have to do is understand that so much of the care can happen outside of the walls of a hospital. And I think that's where the VNA is so crucial in our partnership together and how they go and treat so many of our patients. I mean, over 370 visits annually are done by the VNA, and to go into homes and treat patients that need you the most, that need us the most, and prevent them from coming back to the hospital is such a key approach. The wonderful care you do with hospice and palliative care and pediatric care, I think a lot of folks don't understand the true importance of that. Now, in this new world, the VNA in this setting, I think, is going to be even more invaluable than it is right now because of different contractual mechanisms and structures, the need to keep people in their home because we know healing happens so much better in that environment. How do we work and collectively share that data to promote better outcomes? So I think the VNA plays such a key role for us and absolutely well positioned for the future. On
that same note, there are many entities of Cape Cod Healthcare and award-winning historically. I don't know if you have that sort of list off the top of your head, but many of the hospitals, the VNA, have a good history of success and quality.
Well, we're very proud of every entity in our system, and I should say Cape Cod Hospital, Falmouth Hospital, the VNA, JML, Skilled Nursing Center, and Heritage Assisted Living all make up, as well as over 100, like I said, 50 employed physicians, whether it be in the medical affiliates of Cape Cod or hospital-based. I mean, we're very fortunate to have all these partners, both employed and independent. But the institutions themselves have had a great year from a quality perspective. The VNA was recognized as having the gold standard for service and quality, both at the state level and nationally. The premier award that you get every year is really something that all the employees of the VNA and the system should feel great about. Cape Cod Hospital and Falmouth Hospital were both ranked in the top 100 this year from a quality perspective by Becker's, as well as Harvard Pilgrim Healthcare, Falmouth being the latter, recognizing the incredible care that they give. Both hospitals have been recognized by Blue Cross Blue Shield for their excellence in stroke care. So we're very fortunate to be well recognized. Many of our physicians are known across the state as having some of the best outcomes. Dr. Zellman in interventional cardiology comes to mind. Our service scores and the Press-Ganey scores, voice of the consumer, are routinely above the 90th percentile in the inpatient unit and emergency room. So we're very proud of the awards and recognition, but to me, it's more about our employees, what they've been able to do working together to really take great care of patients. We're indebted to them.
Mm-hmm. That's great. And for the viewers, I think, that think of being here, or do we go someplace else, sort of the shop local, the quality of the system here certainly speaks to staying local and doing the buy local.
Well, we certainly understand the importance of the Cape Cod economy and our role in it. This year we will have over $750 million in revenue. And if you look at a multiple of $2 for every dollar we spend in the local community, we have an economic impact of approximately $1.5 billion on the Cape. We have 4,700 employees, and the average salary is about $63,000, $64,000 a year in the hospital setting. We have those employed physicians. So we are there for our community from that perspective. But more importantly, we're a safety net organization, meaning anytime you come to us, regardless of who you are or your ability to pay, we're going to take care of you, because that's what a not-for-profit community-based health system does. And we're there for our community. So we strongly encourage people to move to the Cape, strongly encourage our employees to buy local and stay local and utilize healthcare services local. And I think we've invested back into the community. Over $100 million have been put back into the local economy over the past 3 years, with facility renovations, with information systems and technology that has all put people to work, but more importantly, made us a place that I think Cape Codders can be proud of, that they want to come and get care from. And that includes every entity out there. So it's been a remarkable journey, one that we're all lucky to be a part of.
Yes, yeah. Now the Regional Cancer Network.
Yes.
I want to be sure we touch on that. Believe it or not, we're like down to 5 minutes, so I just want to make sure you get that in, that's something new and exciting that people have maybe seen in the paper or on TV.
Well, the Regional Cancer Network really was kicked off by the Clark Cancer Center. And for the first time, we took a Cape Cod Hospital licensed entity and shared it with the Falmouth campus. So we began to be part of the solution by sharing services. And we knew that 30% of all of our patients came from the Falmouth area. So we took that locally. And what it really meant was Cape Cod Hospital doctors and Falmouth Hospital doctors were communicating. We have cancer committees at each campus and that work together. And we leveraged that collegiality and information to really kick off the Regional Cancer Network, which is a group of physicians, both employed and not employed, that all coordinate patient care together. And it's not just the medical oncologist or the radiation therapist, but the general surgeons, the pathologists, the physical therapists, the pharmacists, everybody in the local cancer care arena, all being collaborative to improve patient outcomes. And that's also meant that we've been able to keep more care local, have access to better clinical trials. And we've done that with our relationship with Partners Healthcare and Dana-Farber. So, together we've been able to leverage, I think, the best of everything and really provide a comprehensive approach for our community.
And what that means to the patients out there is they don't have to travel.
They don't have to travel.
That's right.
That's exactly right.
So we have maybe 2 minutes left. Is there anything that we haven't touched on that you wish viewers would know about Cape Cod Healthcare, or the security that they can feel in shopping here on Cape?
Well, I think that something that is gaining better recognition now is really the quality of services that we have. All the services that we provide are exceptional, and some things we can't do, but most we can. And if people come back to one of the Cape Cod Healthcare entities that haven't been there in a while, I think they'll be surprised of not only what they look like, but how they're treated when they come in. The compassion and the smiles and the warmth that our employees provide and give to our patients, I think is second to none. The relationship that we have with our physicians, the fact that we're there for our community regardless of who you are, I think all says a lot about what Cape Cod Healthcare is, what we're trying to become, and that we have a plan, we have a strong vision for the future, one that should be able to allow us to remain independent, community-minded and focused, and dedicated to the treatment of the patient.
Great. Thank you, Mike, today. That was great. I appreciate you being here.
Thanks for having me.
And I'm wishing you good health and good health care.